Okay, 3-17, I'll move staff recommendation. Second by Supervisor Tapaloni, please vote. Let the record reflect it passes 4 with 1 absent. Taking us to 3-19, Riverside County Regional Medical Center approval of First Amendment to the agreement with Thompson Alliance. We have Paul Jacobs. He's been given 3 minutes by Mr. Gary Grant for a total of 6 minutes. 3-19.
Thank you, Chairman Stone, members of the board, and citizens. My name is Paul Jacobs, a retired health worker from Temecula. And thank God I stuck to patient care in my career and didn't get into the administrative side of things. But this item piqued my curiosity, partly because what was originally a $938,000 contract a few months ago is now a $2.34 million contract. Things got more curious when I delved into the staff report for today's item, and even curiouser when I read the July 1st staff report when the contract with Thompson Alliance was first approved. The original request for proposal went out to 6 prospective bidders in March of 2014 with no response. Even the incumbent vendor was not interested in bidding, so a revised RFP was sent out again in May, again to 6 different vendors, and also advertised on the county website. There was 1 responsive bidder, Thompson Alliance. I would think in the world of healthcare there must be a number of companies providing case management services. It seems odd that the county purchasing department had such difficulty getting qualified bids. On the internet, I found a company called NCQA that provides case management accreditation, and it seems county purchasing could have gotten a long list of qualified bidders from NCQA. So then I became curious about the successful bidder. Using corporationwiki.com, one of my favorite internet resources, I found out that Thompson Alliance filed articles of incorporation on May 2nd, 2014, the very same month Riverside County put out the second RFP. In July, this new company was awarded a $938,000 contract. 3 months later, the contract amount is being more than doubled to almost $2,345,000. Thompson Alliance is having a spectacular first year in business. And I'm not saying anything is wrong with that, it's just a bit curious. My brother-in-law is a doctor, and when he had his own practice, one of the most valuable members in his office was the one who processed insurance and Medicare claims. Having months or years of deficits due to unprocessed claims was not a viable business model, but the county hospital let things pile up. It seems strange that case management is contracted out. As I understand this item, 6,600 case days have been reviewed with a projected return of over $10 million. Another $6 million is anticipated from the remaining review days. This contract exists to process a backlog that is apparently now close to 20,000 review case days, while, quote, hospital administration is working eagerly in their recruitment for skilled individuals while current case managers receive ongoing training. Maybe the county medical center should consider contracting with a company like NCQA, the company I found on the internet that does case management accreditation. The July 1st staff report stated, quote, the hospital case management backlog is growing significantly on a daily basis and is reaching close to 12,000 patient days. This amendment today provides for an additional 15,000 review case days. I'm reminded of that I Love Lucy episode when chocolates keep coming down the conveyor belt faster than she could handle them. Is Huron still around, or was this not part of their lucrative contract? And Chairman Stone, you talk about black holes in Sacramento, so I'm curious what you call it when the county hospital case management backlog increases from 12,000 to 15,000 cases. Obviously, the county gets a good return on the money as reimbursements may expire if not processed, but glaring problems with hospital management still remain. Although the county is recouping up to $16 million, that money is not profit. It is just a tardy payment for medical services rendered. And an upstart company in Pleasanton, California is pulling in a cool $2 million to continue a cleanup operation from years of administrative mismanagement at the county hospital. It is difficult to believe that only one qualified bidder was found after 2 attempts by county purchasing. It seems like the purchasing department may also suffer from mismanagement-itis. Perhaps they caught it from the hospital. It seems Thompson Alliance has produced the results the county needed, although we'll never know for sure that their price is competitive. I guess we should all thank Thompson Alliance for saving taxpayers from a county mismanagement mishap. In reading the July staff report, each time purchasing put out the RFP for case management services, it went to only 6 prospective bidders. Why not send it to 12 or 20 or more providers? And even look out of state. I've just got 2 more things to say. Like I said, it's a curious situation. I'm wondering how eager hospital management is to find skilled workers. I recall that the hospital also had to contract out for dietary services due to recruitment issues. Between the difficulty finding qualified workers and bidders declining RFPs, you'd almost think people don't want to work for or with the county. Thank you for the extra time.
You bet. Supervisor Jeffries?
On occasion, the speaker, Mr. Jacobs, hits a home run. On occasion, it's a strike. This one's a home run in my book. This has got an issue that the hospital just keeps coming back for more and more and more. And look, the rate of return on this is pretty darn good for saving the hospital. I'm just wondering why we missed it so bad on the initial contract. Why are we $1.4 million off on a $900,000 contract? And it may be a simple answer, and someone's going to catch the fly ball, and it's not going to be a home run for Mr. Jacobs, but tell me a little bit more about how this happened and how it's going to help.
Speakers down.
Great. You're fine.
Everyone's had their turn. Good morning, gentlemen, and I too want to acknowledge a very thoughtful discussion on the part of Mr. Jacobs. Good material, good issue. This has its genesis, not making excuses, sharing information. Prior to 2014, the State of California Medicaid program did the analysis of whether the interqual for the days were going to be allowed or not. And the 15 county hospitals, along with the University of California, California Hospital Association, asked that that responsibility be transferred from the state to us. The statement, "Be careful of what you wish for," rings only too true for us in this particular situation. When that transfer happened, we did not and still do not have, like many of our peer county hospitals, the requisite skill set to keep up with all of these transactions. So we started bubbling up and building an inventory. One of the things that caught my attention with our finance staff was, jeepers, guys, we've got care at risk and we've got money at risk here. And so we went out to find a organization that could help us catch up while we take our employed case managers through a critical amount of training and a critical amount of development so they can perform this skill without this service to the satisfaction of the State of California Medicaid program. That is progressing, but it is not finished. And so we are still, unfortunately, in need of an outside vendor to help us not lose our dollars. I wish it were not so. I wish that we were, like every other county wishes, we were able to recruit more skilled, trained professionals. These individuals that incorporated, I do not know factually, but I would speculate that they are former employees of the state of California that was doing this work, that have now branched out. They're doing this as a newly organized company. The product is excellent. The people from the state program have commended Miss Nightingale, who's overseeing this activity, and her team for making progress. But we still have at least 15,000 claims that are days that we need to get processed to their satisfaction. And that's the story, and I'll do my best to answer any questions.
Thank you. Any further questions for Lowell? Thank you very much.
Thank you, sir.
The will of the board. Moved by Supervisor Tavaloni.
Second.
Seconded by Supervisor Ashley. Please vote. That passes 4 with 1 absent, taking us now to 3